or good day. A report just came out, Harvard, Cornell University, on COVID, and it distinguished big international coverage. It distinguishes between three kinds of societies. Those that have exercised in relation to COVID control, the example is Taiwan. Those that have followed a consensus approach, example is Germany. And the third one, chaos, and the example is the United States. And it also mentions Brazil as an example. And we hope, Alberto, that you will shed light on this situation. And while it's also tempting to talk about Brazil in general, because there's so much to say, we don't want to distract the attention. Adalberto Cardoso has been working in labor sociology and has published many books. In fact, we did one together some years ago, and that was, gosh, it was a more optimistic era. And Adalberto, since then, you have turned your attention to Bolsonaro and more recently to COVID. So please, let's give a welcome to Adalberto Cardoso. Thanks very much for joining us.
Thanks.
Please, Adalberto, yeah.
Thanks for the introduction. It's nice to be here. It was a pleasure to accept this invitation to speak to this selected audience. I'll try to see if I can cope with it. What I'm going to do here is to talk about a bit what happened and is happening in Latin America and Brazil, in particular concerning the modes of governance of the COVID pandemic, okay, and some consequences for our population. I'll be reading most of the time because, you know, this is a foreign language, a third or fourth language, and it's easy for me to read. If you have any questions or doubts while I'm reading, please just say, stop, repeat, whatever. On February 26, 2020, we had the first confirmed case of the new coronavirus in Latin America. In Brazil, the first death occurred in less than a month as a result of the encounter between the new coronavirus and the profoundly unequal social order. A domestic worker contracted the virus from her employers who had just returned from Italy. At the age of 63, suffering from obesity, diabetes, and hypertension, the worker still kept working because she did not have enough social security contribution time to retire. And of course, it didn't even cross the minds of her employers to offer her a paid leave that would allow her to remain in quarantine. On the contrary, she was stubbornly requested to appear at the workplace. As a result, the rich couple that lives in the most valued square meter in the country followed the course of their daily lives, all healthy and alive, while the worker with comorbidities and without a private health plan died of COVID-19. This case is not only symptomatic, but also paradigmatic of what the Latin American drama in the pandemic would become. Although Latin America and the Caribbean represent only 80.2% population, the region concentrates about 18.5% of the confirmed cases and 28% of deaths by the new coronavirus in the world. These figures are of December 23. To give you an idea, with a population of approximately 213 million people, on January 19, 2021, Brazil alone reached the bleak 215,000 deaths, a figure corresponding to more or less a third of all deaths that occurred across Europe. The international organization Vital Strategies estimates that due to the excess mortality observed and strong underreporting of actual cases, the country must have reached that mark weeks ago, perhaps months ago. This leads to a second point, also crucial in the case of Latin America. Currently, it is said that with the advance of the second wave in Europe, the old continent would occupy the first world position in the ranking of positive cases, 28%, and deaths, 29%. However, this finding must be properly nuanced by the category testing per million inhabitants. In global terms, Chile is the Latin American country with the highest ranking in terms of testing per million. According to the Worldometers website, the country occupies a relatively reasonable 53rd position in the total 220 countries. The second best place country is Panama, 58th, followed by not so reasonable Uruguay, 87th, Peru, 94th, and Colombia, 95th. Brazil and Argentina occupy 103rd and 110th positions, respectively. Data from January 11. Worse, Mexico ranks 158th. But to have the scale of the problem, according to official data, in the 5th epidemiological week, Mexico accumulated an excess mortality of more than 271,000 people, which is 30% higher than expected on average, 2015, 2018. In other words, introducing in the equation the low rate of testing, the consequence of which is the high underreporting of cases of the Latin American continent, at least we raise suspicion whether Europe is currently the region most affected by the new coronavirus. I said we, this is not a royal thing. It's because this paper is written by me and Tiago Brandão Pérez. I forgot to mention this in the beginning, a colleague from Rio. The fact is that in May, Latin America became one of the global epicenters of the new coronavirus pandemic. And as of mid-August 2020, Reuters certifies that Latin America had become the region with the highest number of positive coronavirus cases in the world, and most likely we have not left that position since. Now I'm going to talk about some institutional strategies that dialogue a bit with the three the three categories of classification that Jan just mentioned. Although the creation of different and crucial income transfer programs is observed in many Latin American countries, be them direct, focusing on informal workers, domestic workers, unemployed, small self-employed workers, and beneficiaries of past income transfer policies, or be them indirect by means of credit for companies, the most successful countries in combating the pandemic were those that adopted some sort of collective responsibility or responsibilization. That is, these countries implemented a set of institutional strategies that prioritized, above all, prevention to halt or reduce the speed of communitary transmission of the virus, some kind of consensus, just like Jan mentioned. Their addition to social isolation was to a large extent obtained by persuasion through public authorities' frequent and transparent pronouncements and official publicity campaigns on the indispensability of personal protective equipment, upkeeping personal hygiene, as well as by the coordination of policies between the different levels of the executive, federal, provincial, and municipal. Irrespective, this is important, irrespective of party affiliation vis-a-vis the incumbents in power. The population was convinced by scientifically supported statements to voluntarily engage on the safety measures put forward by the public authorities. Evidence of this is in table 1. I'm going to share this table for you. I'm sorry. Well, it's okay. It should be better, but you can see here, we've selected 9 Latin American countries, including 8 South American and Mexico. If you look here, these are the countries that adopted collective responsibility: Uruguay, Argentina, Colombia, and Bolivia. And these are the ones who adopted individual: Mexico, Ecuador, Brazil, Chile, and Peru. We can see that in the 4 countries that chose collective responsibility, the number of deaths per million were much lower than in the other 5. You can look here, 10, 80. This is until July 2020, right? We're showing this number now, and we're going to show more recent ones later. But much less than those that chose individual responsibility. Note that the death rate in the first group is also positively correlated with informality. You see, 23, 24, 48, 61, 85, and seems not to be affected by the scope and reach of income transfer programs. That is, informality reduced the effectiveness of public policies. But even in the highest informal economy in the first group, Bolivia, had near half the number of deaths per million than the least informal country in the second group, Chile. Right? Uruguay is certainly the most successful case, being the least informal country in Latin America. 24% of the occupied labor force reported only 10 deaths per million, and it's a small country, only 3.5 million inhabitants. On the other pole, Peru, with 31 million inhabitants and near 70% of informality, faced the tragic rate of 588 per million in July. The figures got much worse, but this is just July. So, talking about these 4 cases of collective responsibility, when COVID landed in Argentina in February, poverty afflicted 35% of its population, approximately 15 million people. Shortly after the first death record in the country, also the first in South America, borders were closed and the population was strictly quarantined, which was successfully extended until September 2020. With selective, very, very selective flexibility. Colombia followed this path and in the first week suspended classes, closed borders, and built large-scale field hospitals to shelter patients with least severe forms of the disease, so that ICU facilities could remain available to those in need of intensive care or medical respiration or mechanical respiration. In coordination with provincial and federal authorities, some cities adopted strict lockdowns. In Uruguay, in addition to quarantine, one of the first institutional strategies was the cancellation of classes, of presential classes, and the announcement of distance learning plans using computers and online tools previously provided by the SABLE plan, the slogan of which was "one laptop per child." Schools should and did remain open, only to provide meals for students, for the poorer ones and all students. The country was also paid special attention to cases of COVID in prisons. This is the opposite of what happened in Brazil, with immense mortality in prisons. Bolivia, on its part, quickly decreed quarantine, the violation of which could lead to imprisonment for 8 hours. Limiting hours of public and private transportation, establishing specific opening hours for essential services with limited use of one person per family, etc. Subsequently, it prohibited the suspension of services such as water, electricity, and internet due to non-payment, due to default, and reduced electricity tariffs. All these countries introduced some kind of income transfer programs. In Argentina, the programs reached 2 out of 3 Argentine households. In Colombia, transfers reached 20% of the total households. In Bolivia, 55% of the families were benefited by a set of old and new programs. Uruguay was the least generous, for there the new program reached only 5% of the population. But Uruguay has much better indicators of social protection than its South American neighbors, which may explain why it did not rely heavily on CTPs. Coordinated actions between public authorities in the 3 levels of government, reliance on science expertise, and strong communicational strategies devoted to persuade citizens of the benefits of social isolation, use of masks and continued self-hygiene, along with efficacious cash transfer programs, explain the lower rates of death per million people in these countries. Now, the cases of individual responsibility. Differently enough, Chile, Ecuador, Peru, Mexico, and Brazil have chosen to direct their efforts towards individual responsibility to combat the pandemic. That is, they focused on the treatment and remediation of the most severe cases of COVID. With milder quarantines, they concentrated on expanding the number of hospital beds to prevent the collapse of the health system, or left their citizens at the mercy of the virus without establishing coordinated strategies. In addition, except for Brazil, the coverage of income transfer programs was worryingly timid. Chile, for example, enacted the so-called dynamic lockdown that restricted circulation only in specific neighborhoods instead of entire municipalities. This more flexible measure contrasted immensely with the armed forces on the streets that imposed a curfew between 10 p.m. and 5 a.m. This aimed at preventing circulation, theft, and looting, but above all, at restraining the return of the protests that had intensified in the last quarter of 2019 and had cooled down during the pandemic. Through the bono Covid-19, Chile covered 32% of the families, but the amount of money was very low. The low adherence of individual isolation for many, because many needed to keep on working, combined with insufficient provision of new beds for hospitalization, either for COVID or other diseases, resulted in the collapse of the hospitals with a consequent increase, very high increase in deaths. Peru established a different isolation policy, but with remarkably similar results. In the early days of the virus, it is in its territory, an inflexible quarantine policy was established with armed forces barriers between municipalities, police patrol, mandatory use of masks, establishment of fines in specific days for men and women to leave the house to buy goods or essential services, etc. The sudden and rigid restrictions, however, had an opposite effect in comparison to the countries that chose collective responsibility by means of persuasion. Hundreds of thousands of people were unable to return to their homes and had no money to stay in the cities they were confined to. This forced a considerable number of Peruvian workers to walk in large groups for days, gathering in hostels, pensions, and on the streets and roads, exposing themselves to both the virus and the army's brutality. And while the country quickly announced a series of programs aimed at the poorer populations, rural and self-employed workers, the bono Yo me quedo en casa, reached only 2.5% of the Peruvian families. Ecuador suspended school classes, closed borders, made constant official pronouncements, decreed curfew, but was unable to establish an effective social isolation policy. In addition, the country has 4.4 million people in poverty or extreme poverty, and the Bono Protección Familiar covered less than 1 million Ecuadorians. As a result, in less than a month, the hospital system collapsed, and with it, the funerary system. Many bodies of people killed by the COVID-19 in the city of Guayaquil, for example, were plundered on the streets and parks or stayed for days at home awaiting the public authorities to collect them. Last but not least, Mexico was the last Latin American country to establish measures of social distancing as a way to contain the community transmission of the virus. State and municipal governments and civil society entities faced the difficulties of proposing measures to protect the population while dealing with a persistently denialist president. On March 15, for example, when the country had 44 confirmed cases only, Andrés López Obrador urged people to leave home to live their normal lives and affirmed that the Mexicans made up a strong ethnic community and that for this reason, they would overcome COVID just as they did with other pests. He was severely criticized by national and international institutions for his practice of kissing babies and hugging supporters, living up the slogan used in his presidential campaign, exchanging shots for hugs. Ignoring that, during the pandemic, these hugs could also be fatal. To give you an idea of that, Obrador was seen wearing a protective mask for the first time on a commercial flight to Washington only in July, when the country had already recorded more than 32,000 deaths from COVID-19. The main local measures were enacted without the coordination of the federal government. In this sense, it was a bit chaotic too, but less chaotic than in Brazil and the US. In fact, Mexico City was the first to enact quarantine and other measures to restrict circulation in the capital, followed by the governor of Jalisco and 7 other Mexican states that, in addition to restrictions on the circulation of persons, also suspended flights, particularly from the United States. Only on the day that the first death was confirmed in the country, the federal government promised to allocate meager $145 million to purchase medical and laboratory equipment, hygiene material, and respirators. Ineffectively enough, Obrador tried to stop layoffs due to the crisis and decided only to anticipate the payment of disability pensions and to offer credit to people and companies through social security in the case of formal ones, and for informal families, micro enterprises. However, despite the promise of the federal government's microcredit program to serve 4 million people, only 1 million obtained it, the value of which did not exceed $1,100. On April 13, Bono Covid-19 was awarded to health professionals who, until January 6 this year, passed on a 20% increase in salaries to 160,000 hospital workers who deal directly with the pandemic. No relief money or credit was adopted for the poorer portions of the population. It is no wonder that of the 53 economies with a GDP that exceeded $200 billion analyzed by Bloomberg, in late November, Mexico was considered the worst country of all to be during the pandemic. Furthermore, in September, a specialist estimated that the country was underreporting 70% of deaths by COVID-19. Talking about the moving target of COVID and the case of Brazil. As the introduction to the book organized by Jan Pietersik, Crisis Reveals COVID-19 Governance, forthcoming in April maybe, identifies COVID is a moving target. That is, the different countries and states, cities, and neighborhoods are at different stages in the community transmission flow of SARS-CoV-2, and the responsibility pattern adopted acts directly on this flow, intensifying or delaying it. Collective responsibility intends to guarantee, above all, the life of citizens, keeping them away from the virus or preventing the collapse of the health system. It does, however, require continuous governmental effort and society's adherence. Otherwise, it will not resist the pressure from the economic sectors, the civil society, politicians, etc., so that the country returns to normality. The 4 countries that adopted collective responsibility gave in to pressure and began, in their own way, to relax the isolation. In Argentina, for example, the necessary lockdown was dubbed quaranternal, a wordplay with words quarantine and eternal. The governments gave way, and the outcome could not be different. There was an explosion in the number of positive cases and, unfortunately, deaths. This I'm going to show in the table that I'll have to... Can you see the table? You can see here the proportion of deaths per million is still lower in countries of collective responsibility to some extent, because adherence to isolation and the persuasion about the need for minimum preventive care persists. On the other hand, in individual responsibility, negligence and or low government effort cost hundreds, thousands of lives lost daily and unnecessarily. And often the actions seem to play in favor of the virus. You can see here, this is a heat map that starts cool, green here, and gets redder and redder as time goes by. And you can see that in the end, most of the countries are red, but the collective responsibility is a bit, if you take the mean from here and the mean from here, The mean here is much higher, right? Is above 900, and here is somewhat close to 700. So in Brazil, the virus found a strong ally. If Mexico was doomed the worst place to be in the pandemic, Brazil was probably the second, and at least for us, most of us Brazilians. We also have a denialist president surrounded by an irresponsible, incompetent, and even criminal team of ministers, including the military that runs the Ministry of Health and was reputed an expert in logistics. The succession of disastrous actions taken by him and his assistants, and also by Bolsonaro, have cost thousands of lives in Brazil. Brazil has a public unified health system, the SUS, S-U-S, a notable national healthcare system that is integral, universal, and free, product of the 1988 Constitution. The SUS had extensive expertise in combating epidemics and other respiratory diseases such as H1N1. The control of the Zika epidemic in 2015 and 16, for example, showed that Brazil was one of the world leaders on scientific research on epidemics, for example, for correlating the infection with cases of child microcephaly, and was capable of producing several laboratory inputs in its decentralized network of laboratories, such as Biomanguinhos Fiocruz in Rio de Janeiro and Instituto Butantan in São Paulo, and even laboratories of the army. As a consequence, many analysts presumed that the country was in a relatively better position in terms of state capabilities to minimize the social impacts of the COVID. However, this was only partly the case. In fact, before the pandemic, only 9.8 of Brazil's municipalities had intensive care units, beds in their hospitals. And of the 50,000 available in the country, only 22,000 belong to the SUS. This is 5 times more than in Mexico. But anyway, it's only half were public. At this point, the weight of the social inequality becomes evident. For the poorest, people faced the dilemma of dying at home or in hospital queues, while the private hospitals soon started to open for elective surgeries and treatments not related to COVID-19. Table 3 will offer a clear picture of that. This table shows, this presentation should be, okay. You can see here the correlation between schooling and the mortality rate of people hospitalized because of COVID. We're not talking about infected, we're talking about hospitalized, right? The relation is direct and strong. You can see from, in Brazil, schooling is directly related to social status or class or social class. I showed with my colleague, Edmond Pretzel, for example, that if a person has a higher education degree, it has 85% of chance of figuring in a middle class position. So, and we have a huge literature showing that every year of schooling adds 10%, 12% in the people's salary or family per capita income. So, when we're talking about schooling, we're talking about social stratification. And from no schooling, illiterate, a death rate of 51% until 19% of those with 12 years of education or more. If we if these data were broken down by those with with a diploma, right? This figure would be much smaller yet. So, moving from lower to higher education means moving up the social structure and, as can be seen, strongly reducing the chances of being killed by SARS-CoV-2. Brazil faces a deep crisis of governance in handling the pandemic. First, President Bolsonaro speculated that the pandemic would kill at most 800 Brazilians without mentioning where he got that number from. When the country surpassed 40,000 deaths, He urged his supporters to invade hospitals to check if they were indeed overcrowded and if the number of deaths was real. The result was that part of the population began to demand the opening of coffins, greatly increasing the likelihood of contagion, for many believed them to be filled with stones, not bodies. Bolsonaro himself believed that. This increased animosity among patients, family members, and doctors, including cases of aggression against doctors who gave a diagnosis of COVID-19. The Ministry of Health had a third incumbent, named after the refusal by the two first ones, both physicians, to implement the president's order to impose chloroquine and hydroxychloroquine as the standard SUS treatment protocol. The ministry was handed to a military that populated the office with 1.2 thousand other militaries. And the first measure was to impose these drugs to the SUS because Bolsonaro believes the medicines are effective treatment. The army's pharmaceutical laboratories directed loads of money and energy to the production of chloroquine and hydroxychloroquine instead of antibiotics and vaccines, their original duty. The ministry also changed the methodology of counting those contaminated and dead, strongly underestimating the actual figures, and stopped publicizing the data in its website. After protests by the WHO and the constitution of a consortium of major news media companies that started collecting and publishing statistics on the evolution of the disease on a daily basis, the Ministry of Health resumed the official statistical records, but they were doomed forever. Now we rely on the media data collected by these media companies. In January 2021, alerted by the governor of Amazonas that the state was running out of oxygen, the Minister of Health visited the state and advertised what Bolsonaro and the Ministry of Health called precocious treatment, the combination of hydroxychloroquine, ivermectin, and azithromycin that is proven to be completely ineffective against the virus. The federal government argued that Amazonas was facing a second wave of the disease due to the lack of this treatment. And the master of logistics just failed to deliver oxygen to Manaus. In 3 days, near 50 people died of asphyxia in Manaus and other cities in the hinterland because of this crime. This was a crime, right? But nothing compares to the jeopardy of the vaccination prospects. In August 2020, after the pre-announcement of the success of the third phase of the Chinese CoronaVac, the Ministry of Health announced that the federal government would buy 40 million doses of the vaccine from the Butantan laboratory in São Paulo, which has an agreement with its partner Sinovac to import a set of vaccines and to produce it locally after that. The governor of São Paulo imported 6 million doses of his own at his own risk. The next day, President Bolsonaro said that he was the president and had the last word on everything concerning public health and the federal budget. And disprove his minister, arguing that his government would not buy anything from China. CoronaVac was named the Chinese vaccine, just like the Chinese virus, and discharged as an alternative. He also discharged the Pfizer one, arguing that the laboratory demanded the signature of a term of responsibility, exempting itself from possible side effects of the vaccine. This is a default things laboratories do concerning any medicine and vaccines. When we exceeded more than 1 million vaccinees in the world, Bolsonaro said in an interview that the vaccinees could become alligators. Bolsonaro placed all his tokens on the Oxford AstraZeneca vaccine, but his foreign affairs minister spent most of his time in office shouting against China, taking the side of one of Bolsonaro's son when the Chinese ambassador in Brazil demanded his retraction from offenses to his country, etc. So the foreign minister placed Brazil against its major commercial partner. China. However, the Oxford's vaccine active principle is produced in China. AstraZeneca has an agreement with Fiocruz to transfer technology to Brazil after the acquisition of the first few million doses. But these must come from China. And the Chinese government has said that this will only happen when Brazil changes its approach to their mutual foreign relations. The population will pay the price of the far-right ideological foreign policy. And we don't know when and if we are going to have that vaccine at all. Bolsonaro also tried to import 2 million doses of the AstraZeneca vaccine from India based on an alleged contract of December 2020, but India just refused to do so. When the fiasco was clear and the first Brazilian was vaccinated with the Coronavac in the presence of the governor of São Paulo, Bolsonaro confiscated the 6 million doses of the Coronavac, saying that it belonged to the Brazilian people, not to any governor. So incompetence, misinformation, fake news, denial, and necropolitics guide the federal government's actions. The consequence of this conflictual, sometimes corrupt, chaotic, irresponsible governance. For more than 3 months, beginning in mid-May, Brazil has registered more than 1,000 deaths per day. The rate began to decrease slightly to more than 900 only by the end of August, and to 600 in October 31st. In November, when the number of deaths started to increase again, Bolsonaro said that we are in the very end of the pandemic. In January 2021, the number of daily deaths went back to 1,000, accumulating near 215,000 deaths, or more than 1,000 per million Brazilians, and counting. This is it. Let me see. How do I get out of here?
Jan, I think you're muted if you're talking.
No, Jan, we can hear you. Try to use the computer's microphone.
Can you hear me now?
Yes.
Perfect.
Hey, strange, then this was not working. Adalberto, thank you very much. Appreciate also the wide-ranging and the comparative discussion within the region. I have some questions, of course, but please, let's open the discussion generally first. Please, Alison. Your sound.
Yes, thank you so much, Adalberto. I really liked your approach, and I think combining the economic equity, structural, and policy choice is absolutely the way to go. I've looked a little bit at this issue myself. What I've just posted in the chat is another sociological factor that I have looked at with one of our students, Miguel Fuentes, who is in Mexico, and tracking it that way, and that is gender equity. There was that sort of casual journalistic observation, oh, the women leaders, Taiwan, they're doing better. True, but why exactly? We all love women leaders, but we found that across the board, health outcomes are better in countries with better gender equity. And there are systematic reasons for that in terms of policy trends, and gender equity is associated with greater political participation and other sociological equity dimensions. So I just wanted to see, and as I say, I posted the link in the chat. You can see we even have a nice little chart of gender equity and life expectancy worldwide, and it plays out for COVID. Any thoughts?
Adalberto, you were muted.
Okay, I answered. Okay, it's okay. Yes, I am a sociologist of work, and I've made a lot of research on gender equity during the pandemic, and some of my colleagues too. And we measured, for example, the extension of working hours of women, the fact that telework, remote work is much worse for women because normally they're already involved in care, and when they're working at home, they are those who are in charge of kids and other home services and so on. And men in Brazil, because we don't have gender equity here, and men just don't do anything. And this is all in the responsibility of women. But we're talking here of middle-class women that can stay home, right? In Brazil, one other thing is that women are a major part of the informal workers. And informality is one of the major causes of infection and death. That means that women die more in Brazil than men because of they live longer. So there are much more older women than men. They are more informal than men. They have more comorbidities like obesity and so on. So the rate of death is higher. And this is all due, or in part due to the lack of gender equity. And so this is something really important. And we are aware of that. And this is the same. Yeah. This is the same in Mexico. This is the same in Peru, in Bolivia, in most Latin American countries where we have a high rate of informality that involve women.
Yes, if I may just follow up a slight bit, what you're saying I think is absolutely right, and I have now begun looking at the impact of COVID, of the pandemic, on gender equity and on women because of gender inequity. What I'm talking about is the opposite, or the parallel relationship of the impact of gender inequity on COVID response. You see, just like you're saying that informality makes the impact of COVID worse, informality also makes the response, or contributes to a social syndrome where you have a diminished response. So informality and gender equity both, and other intersectional dynamics of racial inequity too, contribute to worse public policy and to a worse, that shows up in a global health crisis.
I'm not sure if I can talk about Latin America, but in the case of Brazil, the social policies devoted to reducing the impact and the costs, etc., for the poor is gender blind. That's clear. But being gender blind doesn't mean that women are not being benefited, because most of the money went to informal workers, domestic service workers, unemployed. All of these have much higher rates of women in these categories. So women were the most benefited from at least the money that was sent to families. So being gender blind doesn't mean that, because the government just didn't think there's this thing called, Bolsonaro doesn't believe in gender ideology, right? So policies must be gender blind, coming from this kind of ideology. But that's the consequence. In Mexico, you just didn't have this kind of policies, right? You just didn't have money for the poor or whatever. And the policies were also gender blind, with women being informal as much as in Bolivia and Colombia and so on, where you had some policies for women. One other thing is that people in the front line of the combat of the COVID, the nurses, etc., are women. 80% in Brazil, 87% in Argentina, and so on. And in Brazil, Black women, right? And these are the invisible figures in the public policies for the pandemic, right? In Brazil, the policies are devoted to doctors and the higher standard nurses. Then you have a larger participation of men. So yes, there are lots of consequences for this group in particular, right? Yeah.
So maybe I will pose a question. Gustavo, please.
Thanks, Jan. I think my question actually builds on one of the questions that you posted in the chat about the role of the media in Brazil. But I wanted to ask Adalberto if it's possible to speak a little bit more broadly, and not just about media, but especially social media. I thought it was, like Alison pointed out, a spectacular use of data, spectacular analysis of policy, to be able to really kind of compare various different countries is quite useful in that way. And in some moments in your presentation, when you're explaining the individual versus the collective responses, you showed how there was some shifts, and it showed how different governments were responding to different types of popular pressure. And that's exactly where we find the role of disinformation becoming so problematic, playing such an outsized role. Like in Brazil, which is also the case that I'm more familiar with, for me, it's really clear the reason why these types of responses, rather than more effective collective responses, came about is because of a pre-existing large-scale systematic disinformation campaign, which is what brought Bolsonaro to power and what enabled, that kind of disinformation to take root. It's not just coming top down from the president. This is in everyone's WhatsApp, like all the time. So I wonder, maybe you don't have such systematic data, but do you have a basic sense? Is it the case that Bolivia, Argentina, Colombia, that had better, more collective responses, or are these places that are having less disinformation campaigns? Are these places where the social media is less absurd with conspiracy theories? How much blame can we put on these kinds of disinformation, this kind of crazy social media world that is happening in places like Brazil and the US too, versus other places? How important do you see that as a factor in driving the popular protests that tie the hands even of some government officials who want to do well, because then they get kicked out, like so many ministers of health in Brazil and so on?
It's a very good question, and I won't be able to answer it properly because I'm still working on it. One hypothesis that I have is that, or at least it's now clear to me, that the more right-wing the government, the stronger the stake of disinformation in the social media debate. Because the far right or ultra right or whatever you call these Bolsonaro and Trump and Erdogan and all these others, whatever you call them, they stimulate this kind of behavior, right? And they are promoters of this kind of behavior. While in Argentina, for example, you have a clear politics of combating this kind of from the government. So it has an important consequence when the government stimulates or is against or combats disinformation. So yes, I think collective responsibility is easier if the government is not a promoter of disinformation. And you're right about Bolsonaro. It's not only a top-down thing. Bolsonaro responds to the demands of his followers, right? He's always connected. He doesn't give any step to any direction that goes against their followers. And their followers are fanatics that build their identities out of disinformation, of misinformation, of fake news, of lies, and conspiracy theories, right? And Bolsonaro I told you, he believed down there, back there, when we reached 40,000 deaths, that people, there were no actual people in the coffins. Well, you know, in those images of Amazonas with those hundreds and hundreds of graves and people being buried there, he said, there's stones there, no people there. There cannot be so many deaths. And he was repeating what his followers were doing. And his followers actually did invade hospitals when he asked them to do that. So, yes, disinformation, misinformation, and this kind of behavior, when stimulated by the government, does have an impact on this kind of responsibility taking. I think so. But this is, I cannot say this as a hypothesis for many countries, because I know the case of Chile, I know the case of Argentina, I know the case of Colombia, and I know the case of Mexico and Brazil, concerning this particular point, right? And in the case of Brazil, which I am, I take part in a group called InfoVid, which is a group of a multidisciplinary group with lots of epidemiologists, sociologists, and economists, and whatever. And we're all the time trying to follow and map the movement of this misinformation cloud. Fabio Malini, which is a TI researcher in University of Espírito Santo, builds a graph of the tratamento precoce, the precocious treatment, when it exploded in Manaus when the Ministry of Health was there. The cloud was like that, the graph, right? And it was 12% of all the information that circulated in Twitter that day, 12% was of people that was trying to discharge or to show that the precocious treatment did not exist, and that was disinformation, right? 12%. The rest, 88%, were people that, including Bolsonaro, right, saying that Manaus and Amazonas was in that crisis because people didn't take the precocious treatment. So Bolsonaro doesn't believe in collective action. He doesn't believe that. He thinks collective action is the gathering of individuals, putting forward their liberty, their freedom. Right? He doesn't believe in coordinating collective action. He thinks this is the attitude of communists and authoritarian states and so on. It's not the role of the states to coordinate other agents or collectivities. But that's what he does. He's coordinating his followers as a gang, right? As a group that behave as a gang, as militia.
Adalberto, let me slip in a question. I see others have some comments too. Can you hear me, by the way?
Yeah.
Okay. Back to your key contribution, distinction, collective, individual responsibility. On your first graph, you show that in terms of Gini index and in terms of informality, the difference is not really that significant. What then explains the difference in commitment, collective or individual? A related question, a follow-up question will be, well, you can have a collective responsibility, but the next variable is capability. Are you effective in exercising that collective engagement? Northeast Asia, Taiwan, etc., Korean, collective responsibility and capable. Germany, collective and capable. So those are the two questions. But first, please explain to us, where lies the difference between these two categories of countries?
If you look in the beginning, there is a clear correlation in the collective responsibility group between the rate of death and the rate of informality. That's clear, right? because the governments just couldn't stop informal workers to go to the streets and get their, they depend on being on the streets for having something to eat at night, right? So the highest the informal rate, the worse. But even then, like I said, the rate of death was much lower up there than in the individual. There is a small but still important correlation between the rate of informality and the rate of death. The more informal country, which is Peru, is also, even today, the country with the highest rate of mortality. So yes, there is a correlation. Gini index, no, because this doesn't have, has proven not to be so clearly related with inequality. But yes, there is a problem. Inequality raises the problem of the state capacity to intervene in the economic and social process to reduce inequality, which is an important ways to sustainable democracies and so on, sustainable institutions, all the things you've been working on, and me too. So, but this didn't prove an important relation, or at least not linear relation between inequality and individual or collective. Anyway, you can see that the most unequal countries are not in the collective group, right? They're down there in the individual. That includes Brazil, Mexico, Chile, and so on. So yeah, apparently inequality does have a clear relation, though not linear, with the state capacity to work on this either collectively or individually. So I think this is one important issue. The second question, please.
Well,
can you repeat?
Okay, the second question is, but first, a little elaboration on the first one, namely,
Okay.
You explain some of the correlations, but that is downstream. Upstream, what explains that some countries go for a collective responsibility
Okay.
and others do not? Is it history? Is it institutions? It correlates with some variables. Where lies that? What are you looking at?
Yeah, in Latin America, we cannot say, for example, that left-leaning governments were more collectively responsible than right-leaning ones, because you have Mexico and Brazil in the same side. But we did have, in both cases, denialist presidents. López Obrador just didn't believe in the pandemic in the beginning, and it took him months to take measures because he thought that it would just go away, right? Mexico had to reach 50,000, 60,000 deaths for the central government to take effective measures, because he just didn't believe. When it started to affect the economy deeply, right, and affect the state's capacity, money, and taxes, and so on, then he started to work. The Argentine president, on the other hand, he believed in WHO from the start, right? And he took advisory from them from the start, because he believes that and this has nothing to do with institutions. This is the problem with Latin America, or at least most of our countries. Our institutions are kind of flexible in the sense that a president in the presidential system has an enormous power to influence the other institutions, right? In Europe, of course you have that too. Miss Merkel is clearly a very strong woman, a very strong governor, a very strong leader in that sense, right? But all the institutions in Germany were moving in the same direction, led by her. And Europe has a history of not only cultural, But after the Second World War, the idea of the construction of a great Europe or a unified Europe or a peaceful Europe and so on, despite neoliberalism in the last 30 years, there's still this thing about we care for people, right?
Yeah, I refer to it in terms of the quality of the public sphere. Mature conversation in media and so forth. I think, Daniel, you have points to share?
Thanks, Jan. We already were a bit busy in the chat. One question I had really indeed was about comparative studies at this early point in time still. Well, speaking maybe from my historian perspective or so, because obviously some regions in the world might not yet have the numbers that Brazil produced, which is a country with many global hubs, very early exposure therefore to the virus, and maybe then it's not quite fair, so to speak, to compare it to Bolivia or Uruguay. There was one of my questions more on the methodological level, and then I just one thought about Germany, Merkel, the big leader. I don't know. Obviously, she is somehow unshakable, even if the world is in scatters around her. But it's not like the federal states in Germany would just follow her lead. There was a lot of discussion and elaboration throughout the last months. And obviously, a lot of responses were also delayed because there was no consensus to be found. Nobody knows anything. And then at some point, they come just to some sort of an agreement. And if you read into details, you don't even know if it's really an appropriate answer, given the knowledge we already have by now. But these are just minor comments on that side.
Yeah, it was, my reaction was very broad because, you know, watching from here, we see Germany moving in one clear and coordinated direction. Even if of course, it will never be consensual because nobody knows exactly where it's going to lead. And you have different, including scientists, have different strategies and they counsel and they advise different routes and so on. So everybody's testing, right? But there is coordination. That's undoubtful. And even if there's conflict in that coordination, right? We don't have coordination here.
And maybe this leads actually back to the gender question, because somehow this whole masculinity approach of, oh, this virus is only against the weak and the strong will anyways survive, is exactly what perpetuates this chaos of Bolsonaro, no? That there is like this idea of manliness actually that is incapable of coping, while even though Merkel might yet not be like the female role model, she at least can give space for this deliberations, right? And there's no masculinity in her mind that sort of needs to attack a virus with some sort of weird activism.
Yeah, Bolsonaro is the kind of person that takes the decision of not buying the CoronaVac, the 40 million doses that the Minister of Health said he would buy, because he is the one he's the president. He has the last word, right? He is this kind of person. And he has the last word in everything, including the role of women in society, right? And it's clear to him what women are here to do. They're here to raise kids, to take care of family, to go to the church, and to clean your house if she's a housekeeper or a family servant, and so on. He is this kind of person. He is the man, right? He is the man. But going back to your first question, it's a good question because it's not easy. How do you compare Uruguay with 3.5 million inhabitants with Brazil that has almost 10 times that, right? Well, it's much easier to coordinate this small country, you would say. Well, I tell you, if Bolsonaro was in Uruguay, you would have the same level of conflict and the same level of problems in terms of denial and maybe rates of death per million inhabitants, right? So there is, Uruguay is much more closer to Europe in this kind of welfare state institutions that were consolidated a long time. It's the least unequal country in Latin America because of a history of state, in spite of military rules, just like all Latin American countries had in the 60s and 70s. Uruguay could build strong institutions, welfare state institutions, and reduce inequality up to that. So, but if you had somebody like Bolsonaro, then this could be a real problem there. You have this right-wing president now, right? But he's still behaving in the roots of Mujica and the other center or to center left. There is a party change, but there's no strong and problematic policy change. So yes, the size is important. The rate of poverty in Bolivia cannot be compared to the rates of poverty in Brazil. This means that a Bolivian government has much more trouble in saving its population, right, than Brazil. And in spite of that, the rate of death there was very low because of the public policies that were adopted, right, to control this. So yes, it is a problem to compare size of countries, history, country histories, and so on. And this kind of work is always exploratory in many ways, right? It raises loads of hypotheses that have to be researched farther, including other countries, and introducing these kinds of variables and so on.
So, folks, on a more general note, we are social scientists, so the conversation, some of the conversation may be too leader-centric. We have politics, we have policy, which is wider, and we have institutions, and we have history, and we have geography. So all of these elements come in, and the role that leaders say, when we talk about social media, we should also talk about media. Rupert Murdoch has given us Trump via Fox News, with the help of CNN as well. Rupert Murdoch has given Britain Brexit, has given Australia the rift with China, made a large contribution. So there are all sorts of variables that come in. And if we look at the relative consensus in Germany, in contrast, for instance, to Italy, Andrea, I'm thinking of your experience in Italy. That consensus has been in the making for decades and is born from an episode of tragic chaos. So all of these have much larger histories. And if we then compare commitment and capability, the absence of a commitment, leave it to the individuals or the localities. And then when there is a commitment to capability, these are several variables. So I'm not that happy about the Bolsonaro Trump. It's not just Trump, it's the Republican Party. It's not just the Republican Party, it's the structure of the entire media field and so forth. So let's take that into account everywhere. Gustavo, that is an expression of agreement, I see.
Listen, I totally agree with that. But I totally agree. But we must take leadership into account. It's not the only thing to take into account. But of course, when the institutions are weak, For example, we have a strong parliament, right? We have a parliament that exercises checks and balances against Bolsonaro. Our parliament has avoided many of the disastrous measures in the beginning of the pandemic, halting some of the law projects of law, etc. But there's a limit to this, because there's very much that the president can do alone, in spite of the institutions. So leadership counts. We have a Supreme Court that also offers barriers to Bolsonaro, right? And try to stop his intents of a coup d'etat last year. He tried from February to July. He tried a coup d'etat with the armed forces and so on. He was stopped by the institutions, right? So a coup d'etat he doesn't have the power to do yet, because we still have some strong institutions. But he can do a lot of things, like killing 50 people in Manaus for not bringing oxygen and for proposing hydroxychloroquine. This makes a huge difference. We count more than 200,000 people. He is guilty of that. Of course, not only him, all the institutions around him, all the ministers, even the parliament that will not impeach him, and so on. But yes, I think we should take leadership into account.
Andrea, please.
Just thank you, Adalberto. It was very interesting, these comparisons between different countries in Latin America, and also the first proposal of various macro variables is interesting. But it leads me to consider the fact that, unfortunately, we are talking of chaotic phenomenon, because what we saw in Italy is that once in Italy was clear, it's like that all over the world. Once the pandemics spread, you arrive at a certain level of diffusion in which any kind of intervention becomes not really effective. You can be very effective at the beginning, at the very beginning, in which you can be effective in tracing the cases and controlling the small clusters, etc. And that was what happened, for example, in East Asia, because they were able to keep always the pandemics low. For example, in Taiwan or in other countries, it was the same in
Japan,
in New Zealand, for example. The problem is that the level of attention is variable, because the social sufferance is high also in keeping the lockdown situation. So once the situation begins to improve, it becomes more and more difficult to maintain the social distancing measures, and then you have to release them a little bit, and in this process we saw that we were not able to keep the full control, and then the second wave outbreak all over Europe, in Italy, in which we have a problem in effective health policies, but also in Germany, that is more effective than Italy. It's a stereotype, but it's also true under many respects. So the problem, what I would like to say, is that all these kind of analyses are very interesting for analyzing the beginning of the situation. One, there is huge spread of the virus, then the situation goes out of control. As a matter of fact, at the beginning, your correlation were more clear in the until July, and then when, for different reasons, one country didn't manage to keep the control of the situation, then everybody began to be more similar to the other. This is my first observation, and the other one is that I have not a statistical analysis. I did not a statistical analysis, but at the beginning, the diffusion of the pandemics was more connected to, you know, to the demographic variable. For example, it was harder for older people. Women were less touched by the diffusion, children, etc. And there were not at the beginning. I'm talking about the situation in the municipality of Rome. And then once the pandemics developed, the social stratification became more clear. Then you realize that people are more hit by the virus in poor neighborhoods, among a certain social strata, etc. And this is almost clear. I have some colleagues that are doing this analysis in Rome, and I would like to ask them if they have comments for the different stages of the situation, because at the beginning it was, let's say, a little bit democratic, the virus. It was not very much interested to where to hit, and as the pandemics developed, social discrimination became more clear, and it is what I was shocked by the fact that for example, women are hit harder than men in Brazil, and for example, here in Europe, we have a very clear cleavage between women and men. Men are hit hardest than women. So these are some comments that I have. Of course, the situation is very complex, so there are a lot of variables. And first of all, the problem is that the pandemic is a chaotic phenomenon per se, as such. So it's difficult to use the same categories for interpreting the development all along the development of the process.
And the role of science and knowledge in Italy has been also different from Germany and parts of Latin America.
Yes, it is, because you know, it's it was more contested, and at the beginning there was a sort of a complete assignment over scientists, etc. And once the situation began to improve, because at the end of June, the situation, everybody felt that the situation was almost under control. It was a mistake, but everybody more or less thought about that. The scientists began to have less voice, they were less considered in the policies, and then the economic consideration became more and more relevant in the public discourse. This was very clear. And this is what is striking, because the epidemiologists were not at all very happy of the situation in July, because it was clear from their scientific point of view that it was just a downsides of a cyclical process, and we were not out of danger of the risky situation, but it was not what was felt by the rest of the policy community. So it began to, so it was a sign of what we called, my colleague Lucian and I, and also the other colleagues with whom we have been talking about this pandemics. It was a sign of a sort of a weakness of the scientific community, and it was at a paroxystic level in Brazil or in the United States, where the suggestion direction given by scientific community is completely unheard by the politicians. And as in the case of Bolsonaro, and I have colleagues working at the Fiocruz and told me stories, incredible stories, like completely in line on what you have been explaining to us, even in the daily practice of how to carry out research, etc. So it's that's the situation. So there is a cultural side of all this process that is because consider. I was also interested. The last things I would like to say, that Adalberto told that the left and right cleavage is not that clear, because, for example, Obrador was a negationist at the same level of Bolsonaro in a certain sense. And this is something that should let us make some more and unanswered questions yet, because it's not that clear, for example, that for example in Europe the negationists are mostly in the right side of the political spectrum, but it in principle it shouldn't be like that, because right parties in principle should be for order and state order, and why did a rightist politician should abandon any kind of control? That's not at least. So there are a lot of things that still have to be understood.
And some thrive on chaos too. Andrea, mille grazie. Daniel, you have a question. Permesso, everybody. I have a class at 2 o'clock. I will quit now. Adalberto, many thanks to you. Brett, you take over, and I will slip out. Daniel, over to you now. Mille grazie.
Oh yeah, thanks for the invitation.
Bye-bye, Jan. So my question is actually back to Latin America. Is there any word about Cuba? Could we hear something about the healthcare system in Cuba and how the response there is?
Cuba is developing its own vaccine. It's an island. It's an isolated island, and the rates of contamination and death there are very, very low. In spite of all the social problems, all the poverty and so on, they have a strong health system there. They've invested for ages since the revolution in health and education. They export doctors, all over the world to support countries, including in Europe, right? So yeah, they're doing much better than the average Latin American country in terms of contamination and death. But I'd like to comment on some things that Andrea said. Of course, the duration of the pandemic changed everything. Nobody thought that it would take so long. Nobody, nowhere. Only the epidemiologists called the attention to this, that this was not under control, this could happen, and so on. But it's not only politicians, it's the population. The population just couldn't stand it anymore. Stop this, I want to walk, I want to go to the beach, I want to go dancing, I want to go to the bars. You know, especially the younger people, right, the youth. So yeah, the mood of the population changed. So even in the countries where a clear collective strategy was there, it became much more and more difficult to convince the population that social isolation was effective, right? Yeah. Because people started dying in a much lower rate, but dying anyway. In Brazil, we were dying in the hundreds of thousands. In Argentina, in the tens of thousands. But we were still tens of thousands. And it was different. It was more and more difficult to convince people that staying home was the best thing to do, right? And in my country, for example, what's the name for that? Life is very cheap, right? We don't have a cultural, social, and political history of saving lives. It's just the opposite. The state policies the state is seen as people's enemy normally, historically in Brazil. If you go back to the 19th century, where the state was the partner of the slavocrats, right? And after that, the state was built against the internal enemy represented by the people, you know, the dangerous classes and so on. And this only started to change in the 1930s and 40s. But then came the war, and then came the dictatorship after dictatorship. And the state was always against the people, against the poor, no actual social policies to relieve the standard of living of the poor. And the police kills 60,000 people per year in my country. It doesn't happen anywhere in the world. So the price of life here is very, very cheap. And from a moment on, people just said, well, I put my life in the hand of God, right? If I get the COVID, I hope I won't die. If I die, it's okay. I will die in the hands of the police. I will die of other diseases. I'll die out of poverty or whatsoever. Life is dangerous for the great majority of the country, of the population. So this is a cultural aspect of the country that must be taken into account when you see hundreds of, actually thousands of people on the beaches in Rio de Janeiro when the mayor says, stay home. We're still in the apex of a second wave, stay home. And you have 20,000 people on the beaches in Rio de Janeiro. In the beaches in the state of São Paulo, in North Brazil, in Salvador. So people just don't care. I give a damn. I'll live my life, right? If I take the COVID, well, everybody dies someday. This is what Bolsonaro says daily. What can I do? Everybody will die someday. Life must go on. He says that, and the Brazilians, many Brazilians believe that, because this is their daily lives. This is how they go. So duration changes everything in many ways, in many respects, in many dimensions of social lives, institutions, the economy. We are a poor continent. Latin America, we don't, only Chile is amongst the high-income countries. All others are either middle or low-income countries in terms of GDP. We cannot afford 1 year of social isolation. We cannot afford, you know, we're not the United States that can just print dollars, $1.3 trillion. That's what Biden is promising. He's going to print $1.3 trillion. No other country can do that. The European Central Bank can do that, but will not do that. We know that. Brazil cannot do this. Argentina, Chile, it's impossible. So the economy is an important variable to take into account when the time span enlarges. And you see no horizon ahead of you, right? Politicians have to make decisions. The state must have money to pay its debt. You have neoliberal states everywhere. So debt is like a sin, a crime, right? And all the states in Latin America are seeing their accounts, their balances and whatever going to hell. And they must take measures to return to economic growth, increased taxation, and so on. And what's the name of that in English? I'm sorry for my English. I'm just forgetting the concepts that I should use to talk about this neoliberal thing. About the spread of the disease amongst the poorer population. Well, in Brazil, this is just what happened. It started in the richer strata because they were those that could travel to Europe. So people came from Italy and Spain and came infected, and they infected the poor, the household servants, for example. So the rate of infection of the poor is much higher in Brazil, and this is from the beginning. It was just the beginning that was concentrated on the upper classes. That's what that table that I showed you talks about. When you take the rate of death by schooling, right? The rate amongst the less schooled, which means the poor, is much higher.
Higher. Much
higher. And most of all, the sub-notification is enormous in the poorer communities, in the favelas. The later figures that we have here is that in the year 2020, the excessive deaths were around 22% as compared to the last 4 years, ending in 2019. So if this is the case, we're talking about at least 400,000 people dead by COVID-19, and not 200,015, right? So under-reporting is one of the consequences that the poor areas and the poorer communities are dying without reaching hospitals, are dying without being tested. Only 12% of the Brazilian population was tested. That is, only those that reach hospitals are tested, right? We don't have tests of people coming to your house to test you. You call a doctor, come test me or whatever. You have to have some symptoms, reach a hospital, then you test it. 12% of the population. If the rate of death of Japan, which is 1.3%, which is amongst the lowest, right? Korea is 1.7. But if you take Japan, 1.3, we don't have 8 million infected. We have more than 20 million. This is 10% of the population, right? This is all about underreporting, and mostly amongst the poor population that they don't go to hospitals. They prefer to die at home, assisted by their families, by the priest, by the whatever. Then go to a hospital and face enormous queues and be mistreated and whatever. Everybody will die someday. There's also this thing, you know, I'm going to heaven. God is there waiting for me. Many of the poor people do, but they don't go to hospitals. So I agree with you, Andrea.
So we're about 6 minutes past 2. I think maybe this is a good place to end it. So with that, I guess, Adalberto, thank you so much for joining us. Fascinating talk, super interesting. And next week, if any of you guys want to join us, we'll be hosting Tommaso Durante, who will be talking about the global and the visual, how images shape people's common sense of the global. So, yeah.
I hope I can join.
Yeah.
I hope I'll be here. Yeah.
So again,
thank you, Brett, for the invitation. It was a pleasure for me. Very good questions that did make me think and will make me research further some issues that you just mentioned and touched. So thank you very much. It was very good.
Thanks, Alberto.
Adalberto. Prazer. Thanks, Brett.
Pleasure.
Bye-bye.
Bye-bye.